It's not uncommon that young children may have trouble pronouncing certain sounds or words. Common examples include the S initial words such as sun or sandwich, where the S sound may be substituted with a T sound. Words with sounds of R such as rabbit or red, where the R sound may be substituted with a W or L sound. Words with the L sound such as leg and love, where the L sound may be substituted with a W. And finally, words with sounds of TH such as three, tooth, and bath, words with TH sound often substituted with the F sound. Although most children eventually outgrow such articulation problems, some may continue to have difficulty pronouncing sounds clearly, whether because they cannot see or feel what their mouth and tongue are doing, or because they require more complex muscle movements and coordination with their sounds. Assuming no underlying problems that may cause difficulties like a tongue tie, nasal obstruction, or hearing loss, all sounds can be mastered with time and practice, especially under the guidance of a speech-language pathologist. Because proper tongue placement is key to pronunciation, there are some tongue exercises that one can immediately start working with a child prior to seeing a speech-language pathologist. Do perform these exercises like a game to keep the child engaged and excited. Keep in mind that if a child has difficulty performing these exercises on demand quickly, one cannot expect that the tongue can be positioned properly while talking when tongue placement should occur instantly and reflexively. The first series of tongue exercises are tongue pointing. Simply have the child point the tongue in different directions on command. Straight up, down, left, right. Once these are mastered, try diagonals, top left, top right, and bottom right. If a child has difficulty in a certain direction, have the child hold a small candy like a Tic Tac or sprinkle against the lip for 5 or more seconds. For example, if the child has difficulty moving the tongue upward, have the child hold a Tic Tac against the upper lip with their tongue. The second series of tongue exercises is strength training. Have the child stick the tongue straight out, but hold it out as far and as hard as they can for 5 or more seconds before relaxing. Repeat in all the different tongue directions. The final series of tongue exercises is resistance training. Using a spoon, have the child stick the tongue straight out while you try to push the tongue back in the mouth. It should be kind of like a tug of war between tongue and spoon. Do this 5 to 10 seconds before repeating this drill in other tongue directions. Beyond these exercises, application of correct sound production is the final outcome desired. As such, do model the correct production of sounds for your child. Watching you enunciate words properly will help them be aware of what their mouth is doing and how to fix it. Have your child practice saying words that contain the sound that they're having difficulty with. This will help them get familiar with the motor movements that are needed to produce the sound accurately. Drill sounds with your child in a fun way by making it into a game. For example, you can play the I Spy game and have them find objects that start with a particular sound, such as S initial words. Finally, be patient and praise your child when a difficult sound has been pronounced properly. Remember, every child develops at their own pace, so don't get discouraged if it takes some time for your child to master the sounds that they have difficulty with. With a little bit of patience and practice, they will eventually get there. Once your child starts working with a speech-language pathologist, more specific exercises will be recommended to help improve your child's speech more quickly.